This is an ultrasound study of a patient with a history of 18 days back. She had DNC performed in this case of induced abortion, and from that time till now, till today, she is having fever with rigors, severe pain in the pelvic region that extends into the right lumbar region. Now we see this is the uterus in longitudinal section. This is the uterus that measures 8.4 into 3.5 centimeters in longitudinal section. This is the endometrial canal. This is the fluid in the endometrial canal. This is fine echogenicities within the collapsed endometrial canal, and this is possibly bleed. This is the anterior segment, the fundus, the posterior wall, the cervix, the vagina. Now, posterior to the uterus, we do see an approximately measuring 5.0 into 4.4 centimeter echo-filled. This is an echo-filled, different strength echo-filled bright areas within this loculated fluid pocket. This is the loculated fluid pocket, and you see there are a few marginal calcifications seen within it. These are a few tiny marginal calcifications. This is these are the echoes, internal echoes. And now these echoes are of different strengths. They are low level in this region, they are high level in this region. And this pocket of fluid-filled pocket gives posterior wall enhancement. Here you see, this is the posterior wall acoustic enhancement. Seen behind this, when I move the probe into the region of the right iliac fossa and extend it towards the right lower abdominal quadrant, I see another pocket. This is the second pocket, which is also echo-filled, and measures approximately 4.7 by 2.3 centimeters. Okay. Now the total volume in this thick wall loculated cyst is approximately no calcification seen within it, no solid element is seen, and the volume is approximately 19 milliliters in this. And if you do see that, now you see that this fluid filled tract becomes continuous with the globular area, loculated globular area we saw posterior to the uterus. Or it does not make a communication with that. Well, we do see loculated fluid. This is the pocket of fluid. This is another pocket of fluid, and these are being communicated by this tract. Now, two loculated fluid pockets full of bleed with communication between them through a tract. You can see this. This is the first one. This is the posterior one. This is all fluid pocket This is also a fluid pocket, and this is the communication. This region is the communication between the two cysts. This is the communicating point. Now the volume of the loculated fluid pocket seen posterior to the uterus in the pelvic cavity measures in volume. One is the longitudinal view on the right side and one is the transverse view on the left side of the image. You can see tiny echogenicities, called marginal calcifications within the cyst. Now the volume of this cyst is 75 ml, which is again significant in amount. This is the uterus, the anterior segment, the posterior segment. This is the frontal region.
ये fluid है. Fluid सी uterus is.
Uterus. This is the uterus point. Sorry, I'm sorry. This is the uterus. And these are two. This is the same fluid pocket in longitudinal and transverse section. One is in longitudinal section. And you see the posterior wall acoustic enhancement. This is the transverse. This is the uterus in transverse section, this upper part, what you are seeing. And this is the endometrial canal that you are seeing. Okay, let's measure its volume once again. (53 ml) is the volume of this loculated fluid pocket with marginal calcifications. These are the tiny, shiny marginal particles that you are seeing. The associated finding along with this is small amount of fluid in the right pleural space. You see, this is the very small amount of fluid in the right pleural space and very small amount of fluid in the left pleural space as well. Here you see, this is the spleen, and this is the fluid above the diaphragm. This is the lung tissue, air. This is the air shadow, and this fluid seen in the both pleura is sympathetic or reactive in nature. So this is our case of the day. Thank you very much.